My name is Dr. Gavin Hall. I am speaking today on what I consider a missing link in injury recovery. All right, we call it body inhibition, and today is all about the word inhibition. That is the key word that I want you to take away from today. If there's anything that you think, well, what was this all about? The answer is inhibition. I want to teach you and tell you about something we call inhibition. Okay? So, just a little bit about me before we get into this. I want to share that I know a little bit about what I'm talking about when it comes to the body. Okay? I have a bachelor's degree in anatomy, a bachelor's degree in health and wellness, a master's degree in functional nutrition, and then a doctorate level in chiropractic. All right? So that was a long time of school, but it was well worth it in my opinion. And all of this, the goal of this presentation is just to answer the question, why don't all bodies heal fully after an injury? You get injured, doc says, x-ray's clear, MRI's clear, all the tests are clear. Why is there still a problem? Why are you still in pain? My answer, inhibition. All right? That's what I want to teach about today. So, these are the traditional forms of recovery, especially in the wellness center. Today's all about wellness, right? And these are the most common forms of traditional forms of care. All right? We have chiropractic, their goal, correcting the bone, misalignment. Okay? Acupuncture, energy flow. Massage is relaxing the tight muscle, right? That's why they focus on, and it hurts so flipping bad, but it's a great pain. Physical therapy is all about strengthening the muscle, which increases joint stability. All right? And then you get medical and pharmaceutical, which includes medication, muscle relaxants, steroid injections, surgeries, all the other options that they provide on a medical basis. Okay? The most common problem with them all is that pain returns when the treatment stops. If you ever stop going to the chiro, you stop going to physical therapy, you stop doing these other forms of care, the most common experience is, well, the pain came back. My reasoning for that is inhibition. All right? So, what is inhibition? It's simply stated as a body part that stops working correctly after stress, injury, or illness. It's that vague, unfortunately, because there's no great definition. I'm going to show you some research articles about why a muscle becomes inhibited, but the idea is that if a muscle can become inhibited, why can't other things? Why can't an organ? Why can't a nerve? Why can't a part of the brain or other gland or other part of the body also, why can't it also sustain inhibition? All right? That inhibition is just as vague as it stops working correctly. I can explain detail in a little bit, I will in a little bit, with the muscles, why the muscles shut down, how that works. The theory then just provides a greater perspective of, well, if this happens to the muscle, then theoretically, it can also happen to other things. So that's why we keep it nice and vague, is any part of the body that shuts down because of stress, injury, or illness. All right, for example, you roll your ankle. All right, if you're 18 years old playing basketball in high school, you roll your ankle, and a lot of people will experience that the first ankle roll, not bad. Okay, you get up, comes back after a couple of days, maybe a week, and your pain goes away in the ankle. All right? A couple years later, we'll say, you roll the ankle again. All right? They will tell you, if you ever talk to a physical therapist or any other physician, they'll say the ankle sprain, once rolled one time, will continuously roll easier and easier afterwards. 84% of people experience an ankle sprain in their lifetime. And once you experience one, it's easier that the next one then occurs. All right? And it's because when you roll the ankle, you shut down muscles. You inhibit muscles. In the ankle, you have 22 muscles. If in that first ankle sprain, you roll it and you inhibit 3 muscles, you're going to go, you know, the 19 that are still working are doing pretty good at compensating for the 22 that should be working. For the 3 that are off, the 19 are able to compensate well. All right, and take that load. You roll it again, and you shut down maybe 3 more. The more times you roll it, the more inhibitions you have in the muscle. By the time you've rolled it 4 times, people just say, no, I'm now 40 years old. I just wear an ankle brace anytime that I go play ball with my friends. Because my ankles are just weak. They don't find the stability they used to. The reasoning, inhibition. All right? One muscle shuts down over time. You can certainly have a significant trauma. You break your ankle. You have an avulsion. You have a significant trauma. You can shut down much more than 3 to 5 muscles. But most commonly, with your common trauma, you fall down the stairs, you get in a whiplash accident, you have different traumas that occur throughout life. And these traumas add up. All right? You can certainly have those significant ones, though, that will shut down mass numbers of muscles. All right? You have this bad whatever, your bad knee, your bad hip, your bad elbow, your bad shoulder, whatever that bad something is the result of the same thing, all right? You've likely traumatized that shoulder, that elbow, that knee way back when, and then you traumatized it again 5 years later, and then again 5 years later. You're then, however old you are, and you now have a bad knee. You then have to get a knee replacement because you just have no stability in the knee, and now your only option is surgery. In my experience, even if you have pain in the knee, and even if you have no cartilage in your knee, and even if you have all these knee problems or elbow problems, but they don't find anything dramatically wrong with it, the answer is always inhibition. The muscles just aren't stabilizing it anymore. So why don't we get the muscles stabilizing it? Okay? Concussion, that's just a little bit bigger. That I said earlier that if the muscle shuts down, why can't other things, right? The nerves in your brain and your brain connections can certainly get shut down after a concussion. You hit your head on something. A lot of people experience brain fog, difficulty concentrating. There's just not many connections going on up there. It's not the same as it used to be, all right? And it's because that trauma caused inhibition in the brain. The brain's not sending those signals like they used to, all right? So it's pretty cool, but pretty frustrating as well when you don't understand why you're experiencing these very difficult things, okay? Then you have poor recovery after surgery. All right, I mentioned stress, injury, illness. The injury is vague as anything that will injure the body, okay? So when you go get a surgery, even if you had that bad knee and you chose to go get your surgery, have you ever heard someone that went and got a surgery and they didn't have the recovery they were looking for? Typically, it's because when you cut through the muscle during the surgery, it inhibits the muscle. So then you try and do physical therapy, you try and do your rehab, and it's not working the same as it was or should, because the muscles are all inhibited. And so you're strengthening the few that are working, and you're not getting the result that you should if all the muscles were working in that post-surgical case, the replaced knee, the replaced shoulder, whatever that replacement or surgery was, is typically because the muscles aren't doing their job after the surgery took place. So you can't get the full strength or stabilization in the joint, even though structurally speaking, it's all sound. Because that's what the surgeons do. They make sure structurally ligaments are intact, the bone is straight, the cartilage is better, right? Any replacement of the knee, they're putting in new stuff with all their own gadgets and gizmos to make sure that there is stability there. But if the muscles still aren't doing their job, you can bet your bottom that when you're trying to bend your knee, it's not going to work, because the muscle is supposed to bend the knee. What they're doing is just structurally stabilizing the bone to the other bone. Does that make sense? So then you get into this idea that inhibited areas can stay hidden for years before causing pain. And that's just because, as I mentioned previously, you roll the ankle once, you've still inhibited those muscles years ago, and it's still just, you haven't inhibited enough of the joint to create pain yet. All right? So if you've ever thought, yeah, I got into this injury or that injury, then it's still a problem. It's just compensating. We're going to talk about that in a little bit, as long as I'm still doing good on time. Wow, now we start on the 15th. Yeah, please.
Okay, one of the times that I was doing and trying to lose some things down, you know, and I've been working on that kind of stuff and working and stuff like that. And it's interesting that I found is that if you take it and don't put so much water in there, if you drink lots of water, lots of water, lots of water, lots of water, they did that to me. My thing dropped down 2 places down there because of letting people have the nap. Now, you didn't say anything about that one, but isn't that part of that? If you're taking it and doing it good and have your, so when you're bedding, it's not some struggle and all that kind of stuff, but it's there a lot. It seems like it would help the whole thing.
I'm misunderstanding when you're saying that you're staying hydrated and then what's happening. What example? Could you give me an example?
When I take it.
Take what?
Water.
Okay.
And I'll sit on that.
Yeah.
And when I sit on that, when I first got there, I went through it, I fell it through, and I got through the whole thing, woke up in the morning, and I didn't have hardly much, you know. I went
Much what? Much?
Sigh, like if I go into 70, 75 or something like that, and maybe I go the next time done all this stuff, and I'm at 75, maybe it's 76 or something like that. But if I take somebody drinking and take them each time, and I give them a little thing, I give the same thing that meant the same, but I make sure that by them, I want to give them extra ones, I want to give that kind of stuff, all that kind of stuff. When I come back in the morning, that thing has dropped at least 2 times.
When you say that thing, are you referring to pain?
No.
Pounds?
Pounds.
Oh, your weight has dropped?
Yeah. Yeah.
Oh.
It'll actually drop down. It'll actually drop down. It makes you feel better and all that kind of stuff because now you can see that your thing's starting to drop. And I think all this stuff that you're doing, if you've got more power to get that stuff and that kind of
Sure.
all these kind of things, if you had that stuff going and you turn around, then it looks like that you are going to be more helpful. You'll be able to go in and talk people in there. You'll be able to find places where you can actually drop in those kind of things. I was surprised in the last few days or weeks. I sat there and thought, I can't believe that would be so. That would actually drop me down 2 lines and stuff, especially when I like that. And I'm always stronger to do that
Sure.
when I have that stuff. But you hadn't said anything about that. It's the only thing that
We're going to get to organ function in a little bit, and that's where that
no
applies.
problem. I'm sorry.
Yeah, you're good. You're just fine. Thank you for the question, though. So these are a little bit of the muscle-based research articles that we have on muscle-based inhibition. All right, they're all done by physical therapists. Physical therapists are the ones that found muscle inhibition because they're trying to do this rehab, and they're going, I'm trying to get your quad to fire, and it's not firing. What's the problem here? So they went and researched it. They call it arthrogenic muscle inhibition. All right, they did all the research. They just say there's no way to fix it. And what we've found, I'm going to show on the next slide, what we found is that you can reverse the inhibition, all right? Because inhibition, if we get to here, I should have put this slide behind the next one. But a little bit more about inhibition on how it impacts healing. I talked a little bit about the muscle loses power, then the joint loses stability. The more muscles across the joint that are inhibited, the less strength you have across the joint, therefore less stability. Does that make sense? So then you continue that to be a little bit more. If a nerve becomes inhibited, it doesn't send a clear signal. You then have miscommunication. Has anyone heard of CRPS, chronic regional pain syndrome? Yeah, or complex regional pain syndrome. Typically, it's an injury that people say, I have pain in my foot, I have pain in my shoulder, I have pain wherever the pain is. There's an x-ray done, there's an MRI done, there's a bunch of tests done. They have no idea what's wrong, so they put them on gabapentin or a different nerve-reducing drug, right, to reduce the sensation in the nerve, where all we do is we go and reset some nerves. I've treated 3 CRPS complaints in the last month and a half. All right? So that's kind of the idea, just miscommunication. If the nerve's not firing right, it sends poor signals. And that's where your brain starts saying, well, there's burning in this area. Well, in my opinion, it's not burning. You feel it as burning, but that's just the nerve not working, so your brain doesn't understand what the heck is happening down there. All right. Then you can have an organ that doesn't function fully, kind of what you were mentioning. But if your organs don't function fully, you have poor digestion, poor absorption. All right, if you're finding that you have a bad thyroid or a bad this or a bad that, that's typically because those organs aren't functioning, and in my opinion, they are inhibited. I've seen some pretty cool stuff treating organs that are inhibited, and you can find some significant improvement as far as digestion, absorption, pain in the stomach, all sorts of stuff. All right? The problem with this, though, is that other body parts will try to help creating adaptation and compensation. The body's incredible at creating adaptation because it doesn't know you can fix it. So you have an inhibition in the ankle. All right? And then the knee muscles will try and adapt, compensate to stabilize the inhibition that's in the ankle. So if you've ever heard someone that says, well, I've just got chronically tight calves, chronically tight hamstrings, chronically tight fill in the blank, it's because that tight muscle is compensating for the ones that are not working. Does that make sense? So the same thing happens, though, in nerves, organs. The result is ongoing pain and just more injuries in more places. Because the calf is now compensating and the hamstring is now compensating, you get knee pain. And because the tightness in the hamstring is happening, you're going to get this weird hip thing, even though the problem's all the way down in the ankle. Does that kind of make sense? So, I love chiropractic, but in my opinion, the adjustment's correct alignment. Have you ever been to a chiropractor and you felt like you had to go back 2 days later? Because your back's out again or the joint's misaligned again. In this theory, it's because the muscles aren't holding the alignment. Structurally speaking, muscles hold the bone together. So if the bone's not staying, my opinion of the definition of crazy is going back over and over and expecting different result. All right? So that's kind of where I like to talk about. I don't like talking negatively about my own profession, but that's when I was sitting in school, I thought, guys, is anyone else noticing that we're having the patient come back over and over and over and over again over the course of 3 to 6 months, and the treatment is the same. We're pushing the bone, but the bone's falling. If the bone was genuinely just misaligned and we push it back into place one time, it should stick the first time. And so I had complaints with my instructors over and over again. I said, guys, what's up with this? He says, well, the body's just not absorbing the adjustment well enough. So yeah, I got to keep them coming back so you can adjust it. Eventually the body remembers that's where the bone's supposed to be, and then it sticks. That's the day that you're good to go. And I didn't like that answer from my instructors. So then you can get into chiropractic philosophy, though, which is not about this conversation. Philosophy is just you need the spine aligned to be able to allow the rest of the nerves in the body to complete homeostasis, which is great. I love the idea. But if we want to talk structurally about the spine, this is what made sense to me, okay? Now, you talk about massage then. Massage focuses on the tight muscle. I mentioned earlier that the tight muscle is the compensation, yeah? So you go, you get a massage. It feels great for like 3 days. The muscle tightens right back up again eventually because you still have inhibition, which makes that muscle that is working, obviously, because it's so tight, tightens right back up because something has to stabilize the joint if the inhibitions are still present. So what I like to do is I say, hey, let's fix the inhibition, then go get a massage. You can reset the entire joint after we do some inhibition, and then you'll find some changes in pain location. You'll find some all sorts of adaptations that are gone and kind of unwinds, if you will. Physical therapy and rehab focuses on the weak muscle. Weakness is different than inhibition, okay? Weakness, a weak muscle can gain strength. If you do physical therapy, you do your rehab, you do your exercises, and it's getting better, awesome. You probably just had a weak muscle. If it's not getting better, it's inhibited. All right, does that make sense? Medical and pharmaceutical, they focus on pain as a symptom. They don't necessarily, in my opinion, fix many problems, unless you're talking surgical and structural complaints. But as a whole, they just like to lick it and stick a Band-Aid on it, if you will, and call it a day. But pain, for the sake of pain, pain does help you feel better, which is what most people need. They want the pain gone, and so temporarily that's a great relief if you need the pain gone. But just keep in mind, it will not fix the problem, in my opinion.
Is that going to, so if your pain's gone, then you're going to work, or then you're going to
your long-term,
more,
yes.
And then it's going to hurt worse.
That's correct.
Gone,
Yes.
or whatever.
Yep, that's exactly it. The medicine wears off. And so typically if someone says, well, I'm in just significant pain, I've been debating this injection, I'll say, you know what? Go get the injection. That'll help with the pain. I would still come back and do the inhibition treatment so we can get the muscles working while the pain is gone.
Okay.
That way it doesn't come back. As a whole, I like to play with it a little bit more. If you're like at a 9 or a 10, that's when I'm like, no, we need to get you out of pain. If you're rolling at like a 6 or a 7, I'll say, you know what? I like to leave the pain because then you know how the progress is actually going. All right? So, AIM-IT. So let's get to this one. AIM-IT is Advanced Muscle Integration Technique. This is simply the idea that we will test each muscle one at a time to find which one or how many are inhibited. All right? Weak muscles will gain strength, the inhibited muscles can't. I mentioned that already. So if you were to say, oh, I've got an ankle sprain, it's the easiest thing I can fix. If you came to me with your son or your daughter on a Monday and said, oh my gosh, they sprained their ankle in soccer practice today. Great, I'll probably have them on the game by Friday. All right? The ankles respond very well, very quickly. So I'm very well known with the local high school teams because of that. All right? But as a result, as a whole, it must be on the next slide. As a whole, a damaged muscle cannot sustain. It's not inhibited, it's damaged. If you tear the muscle, if the bone is broken, if the ligament is torn, it's not inhibited, it's broken. It's tissue damage. You need to get the tissue repaired, then we can repair the inhibition, reverse the inhibition. Does that make sense? Yeah, so the goal is to reset that muscle and improve joint stability. I mentioned as well previously that it helps find the problem before you cause pain. So if you're thinking, you know, I'm a triathlete, I need to be at the peak at my game, or I want to be the strongest man at the strongman competition, or whatever this game is that you're doing, and you want to just perform at your peak, then come on in, and we'll test every single muscle and in every single joint. I don't typically do that because there are 400 muscles on one half of the body.
Wow.
So it takes a long time if you want every muscle fixed, all right? But we can certainly get it done for the sake of enhancement, performance, and pain prediction, all right? Neural pathway integration, all right? It's a little bit deeper than AIM-IT. It's the same idea, though, all right? Muscle, This one's just muscle integration, based on the idea that muscles shut down because that's where the research was at the time. In 2019, actually, is anyone familiar with applied kinesiology? Applied kinesiology. So applied kinesiology grew into something called clinical kinesiology. Clinical kinesiology grew into what we call muscle integration technique. Muscle integration technique has now turned into probably 5 or 6 different techniques depending on who decided to change, rebrand, and resell. Because this is America and we can do whatever with our products. So you might hear things like muscle activation technique, muscle reactivation technique, muscle neuromuscular rehabilitation. I mean, they change it. The idea is inhibition and we reverse it, okay? Same idea I mentioned with neural pathway integration. The goal is just in 2019, a doctor named Eric Rollin, who is very well trained with AIM-IT and was doing AIM-IT for almost 30 years in practice, he started thinking, well, if a muscle can also become inhibited, is it possible that a nerve can? And so over the last 6 years, he started to develop his treatments, his own treatments for nerves, organs, glands, brain structures, etc. All right? Yeah, I mentioned that. We covered that. We covered that. Yeah, this is where it's great for chronic pain, nerve issues. If people are like, well, I've just had this back pain for years and years and years. They've been to the chiropractor. They've been to physical therapy. They've been to all these places. Nothing happens. I typically like to find out structurally how their muscles are doing. And if they work, then great. Let's work on the nerve. If they don't work, let's start with the muscle stuff, then move to the nerve if we can't get through that pain. How am I doing on time? Great, 7 minutes. Yes, please.
Is there any school of thought where any of this has been applied to ophthalmology or retinology for an eye injury?
That's a fantastic question. The short answer is yes. They've looked into it. It's a bigger fish than they have currently decided to fry. Recently, they've been looking into tremors, essential tremors, different styles of tremors and neurologic problems. They've cured 3 different cases of Bell's palsy. We do a lot of dizziness, vertigo stuff. If you go to your ENT and they're like, we have no idea what's wrong, or you go to your neurologist and they're like, we have no idea. If nothing is structurally the problem, they find structural problems. You have crystals loose. You have this problem. All right? But if they're like, all our tests are blank and we have no idea what's going on, that is when I point the game to inhibition. And that's when I say, we can likely make some incredible improvements. I've seen some pretty cool stuff. You should come by the booth if you're interested, and I can tell you a bunch of stories that I have. If I have time, I can get to some at the end of this. But I mentioned the benefits of both. You can avoid injuries. You stay in alignment longer if you like the adjustments. You feel stronger, more balanced because your muscles are all functioning better. It doesn't correct structural damage. Okay? So if something's broken, you have a torn ligament, you have a torn muscle, you have dead brain tissue. If you've had a stroke and you come into me and say, hey, I want to get my stroke stuff better, I'll say, well, we can try. And my mom had a stroke, so I've been working on her for years, and we've seen some pretty cool stuff. But as a whole, I can't guarantee the same results because I don't know how much tissue in your brain is dead. Is that fair? All right, a couple of stories that I have 5 minutes. I got 5 minutes. This is great. So a runner with ankle sprain, I've mentioned I fix those often. It's probably the most common treatment in my office is I sprained my ankle. Oh no, I want to be on the field on Saturday or Friday, or I've got state next week, or whatever it is. That's probably the most common injury that I repair. Concussions are also pretty common, especially when football season come around. All right. Lots of gym goers. I currently have my location in a gym, and it's growing to where I need to move because there's not enough space. But that's beside the point. Gym goers at the gym that I am currently located, they will say, well, my right shoulder doesn't lift like my left shoulder does. Those are obvious signs of inhibition, and we can correct that quite quickly. All right? If you're doing a workout and there's greater than a 5-pound difference, I know you have a right hand and you're right-handed versus left-handed, but if there's greater than a 5-pound difference, maybe 10, if there's greater than a 5 to 10 pound difference from right to left, I would say you have inhibition in your muscles. All right? So, and we treat dizziness and vertigo. I mentioned that as well. The end result that I want you to just get into mind is that it's inhibition. All right? If the body shuts down, consider inhibition as the problem. All right? The idea between the techniques, AIM-IT and NPI, is just to reverse the inhibition so your body can finish healing itself. I am a big fan of letting the body do its own thing. All right, if you come to me and say, hey, should I get this shot? Should I get this? Should I get that? I'll say the shot has this goal. You get to decide if you want it or not. I just want to tell you and educate you what the heck the purpose of it is, okay? But as a whole, that's pretty much my presentation. If you don't know if I can help you, I'll typically say ask. Doesn't hurt. I do free phone calls, all right? Emails, they're all there. I'd love to have a question. And if I don't know, I might say, hey, I have treatments for that because the clinic up north has treated stuff like that, like tremors, for example. I've only treated one tremor in my office. The guys up north that taught me this, the guy, Eric Rollin, who I mentioned, created this, the neural pathway side of the technique. He does tremors all day, every day now. I mean, the number of people that have tremors is astounding, and it spreads like wildfire when you find someone who can fix a tremor. Dizziness and vertigo, huge, right, with people who have no structural problems. So up north, they get a lot of weird cases like that. Because I'm so small still in St. George, I've only been here about 4 or 5 years, I still do a lot of muscle-based treatments, just because word hasn't spread about the other stuff. So that's why I'm here sharing it. But yeah, that's kind of, any questions?
I have one.
Please.
So you said something about like 400 or whatever.
Muscles on one side, yeah.
So
That doesn't include eye muscles.
Yeah.
Where'd this guy go?
you talked about like you go through the muscles to see which ones.
Yeah.
So let's just pretend that it was my knee.
Sure.
So you're not going to check all 400. You're
Certainly
only gonna
not.
check the ones.
I'll check the knee,
Correct.
the hip, and the ankle.
Okay.
Because of that adaptation that can crawl up or down based on which ankle or which joint is more stable, that's helping support the knee.
Okay. Thank you.
Yep. Great question.
Just like,
And if I have a couple more minutes, I got 2 more minutes. I want to explain a little bit more on the idea of the muscle inhibition, okay? Because I have a lot of research about why the muscle becomes inhibited. Let's actually just leave it here. Muscle inhibition happens. Is anyone familiar with physiology before I get too deep into this? Okay, beautiful. Does anyone know what the Golgi tendon organ is? Golgi tendon organ? Okay. The Golgi tendon organ is where the muscle belly attaches to the tendon. And there's a little sensor there that says, hey, you're stretching your muscle super fast, super far. All right? There's another thing called the enthesis organ where the tendon attaches to the bone. Okay? And if the sensor that is at the bone and tendon attachment is tripped, that's what causes inhibition in the muscle. So you roll your ankle, it starts to roll. Your muscle's starting to get real tense, and right? There's a lot of tension going throughout the ankle. And as the ankle muscle says, we're at like max tension. If we keep going, we're going to rip. You can certainly tear muscle. You've heard of the avulsed or the torn muscle, okay? It can certainly tear. If the sensor goes off, as it should, then the muscle will just relax. And that shuts down the muscle because it allows that relaxed muscle to stretch farther so tension is no longer in the muscle to tear. Does that make sense? So that's kind of muscularly speaking on a very basic level. That's how the muscles are inhibited. All right, the Golgi tendon organ, if the Golgi tendon organ is tripped, it will automatically reset itself because it didn't injure severe enough to cause a permanent inhibition. But that inhibition thing happens when that enthesis organ is challenged. Does that make sense? Yes?
How is it that you're resetting the inhibition?
Great question. So this is very much an Eastern style medicine treatment. I don't have any pictures in this slide or in this presentation. But let's do this one here. No, aim it. So we first, to find the inhibition, we test the muscle strength. To fix it, we poke on the muscle. If you think of the muscle kind of, I don't like the example, but the best thing I've come up with so far is kind of like Velcro. All right, you have something called the Sharpie's fibers where the tendon attaches to the bone. The Sharpie fibers connect them back onto the bone, yeah? Think of that kind of like Velcro. And so when you say that we have the bicep is inhibited, I have to poke on the origin and insertion where each side where that muscle attaches to the bone. I don't typically focus on the belly of the muscle. The belly of the muscle does one thing and one thing only. But that inhibition happens where I said at the enthesis, where the tendon meets the bone. So I have to poke on that enthesis and reattach, if you will, the Sharpie's fiber, re-encourage the Sharpie's fibers back onto the bone. And that also, during the process, it also resets the enthesis organ. So you have to poke on and then you get into acupuncture. There's very specific acupuncture points that I also have to poke on with my hands or kind of on your head or on your belly or wherever these acupuncture points are to realign the energy. There's an energy side of it as well. We can talk about that later. But there's an energy side that we reset with acupuncture points. We just use our finger, so it's not puncture, it's pressure, it's acupressure points. Hope we didn't lose anyone there. And then the poking on the origin and the insertion of the muscle. So if it's a neck thing, we'll be poking on neck muscles. If it's an elbow thing, a knee thing, we'll be poking on, each side of the muscle. Great question. What other question?
Your fingers and not like a machine.
Yes, that's exactly right. So if my hands break, I'm out of work in many different ways.
You're going to have to work on yourself.
Yep. Any other questions? Okay, perfect. Well, thank you very much.